Hello again, class. We are now down to week 7, so we're getting close towards the end. This week we continue on training adaptations, focus on muscle. And this time we talk a little bit more about how to train and an intro into concurrent training. Can you train both cardio and muscle and strength training at the same time? Is there interference? Can you do them both?
Okay, week 7 review. Let's dive in. So, factors to consider when optimally overloading muscles, right, to increase strength, including two things, right? Resistance to muscle action, as well as increasing what of the muscle action, or of course, a combination of both. So we want to increase the resistance, or we want to increase the speed, right, of the motion. Increasing the speed during weightlifting improves your power, as opposed to just lifting it with increasing the resistance, which would improve your maximal strength. All right, next, examples of specific adaptations that occur with resistance training include increased motor neuron what, increased what rates of motor unit, and inhibition of Golgi tendon organs, and that is excitability and firing. So that's one of the several things that occur with the early phases of resistance training. All right. When muscle force fails to exceed external resistance, resulting in lengthening of the muscle, a what action occurs? Now, this is the typical format of these questions. This can be a little hard to figure out, but it's worded a slightly different way, but I bet you'll figure this out here. So when you're going to lift a weight and you, fail at it, it's usually one of two things. One, you don't have the requisite strength to lift that heavy of a weight, or two, you have fatigue and you don't have the strength anymore to lift that weight. So what's going to happen? Or imagine yourself lifting a weight overhead and you're trying to squeeze out that rep and you can't. Well, that weight's going to come back to you, right? It's going to come back down. Gravity pulls it right back down. So instead of getting a shortening contraction of the muscle is going to be forced to lengthen, and you're going to get an eccentric contraction. PRE, right? This should be pretty easy. Progressive resistance exercise, very effective form of resistance training. Another very effective thing here, subdividing training cycles into smaller ones, each with a specific objective, is periodization. All right, and what kind of resistance training attempts to keep the speed the same, right, throughout the range of motion? So you recall those different versions. This one is, yes, isokinetic training. All right, next. Approaches used to determine if a gender difference potentially exists in muscle strength include checking the muscle cross-sectional area overall in terms of the absolute muscle strength as the total force is exerted, right? That's what we're looking at here. And we found out that, yeah, it doesn't matter. There is no significant gender difference. It's all based on the amount of muscle you have, the cross-sectional area of your muscle, divided by the total strength you're exerting via the force there. All right, what intensity, not type, is generally governing strength improvements? And we learned that it is the overload itself. How much you're overloading your muscles is going to govern the strength improvement. It's not the specific type of exercise. That's more in terms of the specificity principle, the sport-specific motion. If you want to get better at whatever activity you're trying to do, you have to gear your workout towards the type of exercise that mimics those motions. But if you're just trying to improve strength, the main thing you need to focus on is the overall intensity of the overload, not the type of the exercise that you're doing. All right, novice and intermediates should train 2 to 3 days a week. However, once you become advanced, you can go up to how many? And that's, 3 to 4 times a week. But once you go to 4 to 5, you're start going to lose improvements since you need to incorporate rest days. Next, periodization includes decreasing training what and increasing what as the duration of the program progresses. And these things go in opposite directions, right? This is the volume and the intensity. Next, resistance training for pre-adolescents should include relatively high what and low what. Hopefully you figure that one out. This is going to be more reps and less weight. The fact that muscles do not generate the same absolute maximum what through all the movement phases represents the major limitation of standard isotonic weightlifting. And that is, yeah, the force. That's the issue here. If you're lifting a barbell doing a biceps curl, it might be harder at about midway through the range of motion. But once you get closer up to the top, it certainly gets easier. So you're not getting the same amount of force. All right, alterations in what function elevate motor output, accounting for the strength increases in early training? And yeah, of course, we learned that one. Hypertrophy comes later on. All right, one factor that may produce DOMS includes what? We learned a lot of those. One of them is acute inflammation. Changes in pH and ion balance produce the alterations in the structure and function of what part of the muscle fiber when they undergo unaccustomed exercise, and that is at the sarcoplasmic reticulum. Yes. Next. What term describes the point in exercise movement against a set resistance, so we're not changing the weight, that provides the greatest difficulty to complete that movement? At what point do we hit in that arc of range of motion? And that is, yeah, the sticking point of the motion. Next, the 4 methods commonly used to assess muscle strength include what? Using computers, right? If we recall this from one of the earlier slides in lecture 12 there. 1 rep max, we talked about that as well. Tensiometry, where we check the tension in that cable. And what was that other one? We didn't really review this too much, but that's the whole point of these PowerPoint review questions here, to challenge you a little bit. What's that final one called? That is dynamometry. All right.